Hi everyone, so it's been about a year since we did the last video for the cancer update. I don't know, things have been crazy busy this past 12 months. Obviously I didn't get around to doing another update, but my wife Hae-Gyung was actually saying that we've had quite a lot of traffic throughout the year in terms of viewing the YouTube video. Obviously people who were searching out kidney cancer and whatnot, so yeah, we've thought I'll do another update now, and we'll try to do an update every 2 or 3 months as well, depending on how things are going and whatnot. So the last update I think was in June of last year, June 2022. Quite a lot happened since then, so I'll talk about everything that's happened. So I remained on my 3 monthly scans whilst on my first line treatment of pazopanib, or trade name Votrient, and there was some growth, and then there'd be some shrinkage and some growth and some shrinkage, nothing significant. But then by the time we got to around Christmas, there was about 50% shrinkage on the lung tumours. So if you remember, there was bilateral lung metastases, so tumours on each lung. My oncologist decided it would be worthwhile to refer me to a radiation oncologist to see if we could radiate those tumours, because they were now down to about 5 or 6 millimeters each one. But the Votrient pazopanib was never going to actually remove them completely. The best we could ask for would be that they would reduce the size. So in January I was due to meet the radiation oncologist, and I had a massive vertigo attack on the day I was meant to meet him, but that's a story for another day. And that's something that we're considering also doing a YouTube video about, is my Meniere's disease and vestibular migraine journey that's been going on for 10 years, totally unrelated to the cancer. But as I say, that's something else that's an absolute nightmare to deal with. So we had to push back the meeting with the radiation oncologist for a week. So I met with him, and he reviewed my scans, he went through everything with me, and he decided I was a good candidate for radiation on these lung metastases. So in January and February, I undertook 8 rounds of very high dose radiation on the lung mets over 8 days. There was 4 days, 1 week and 4 days the following week, Tuesday to Friday and Monday to Thursday. I thought it was going to be pretty easy, the radiation. The first round that I got home and I just vomited like crazy after it. I think, I don't know, lungs are near the digestive tract and whatnot, and it obviously upset me there, and yeah, I just felt like absolute garbage. And the fatigue was just ridiculous. Really was ridiculous. It was really hard work. Like the radiation at the time, you don't feel anything, and the staff at the cancer clinic were amazing. But yeah, the side effects of radiation were tough, with the fatigue and the nausea, the vomiting, to also go with the side effects of the drug therapy from the pazopanib Votrient. So it was all over pretty quickly, like I say, within a couple of weeks, but then it was a waiting game to see how everything was looking, because they can't do any scans for at least 8 weeks. So I was feeling pretty out of breath within around about 8 weeks, like very out of breath. And I have been told that radiation pneumonitis, which is, it's very similar to pneumonia, but obviously it's not an infection, it's damage that the radiation can cause to the lungs. I got told that, you know, there's a chance, but should be okay. And if I do get it, it won't be too bad. So yeah, I was feeling pretty unwell. Saw my GP, I think it was, lose track, see that many people, GPs, oncologists and different oncologists, urologists, and I see so many ologists, it's crazy. But yeah, I think it was my GP who I saw, and he referred me onto a pulmonologist, a neurologist to see, who's a lung specialist. So I saw him, Dr. KK. That's his short name because I can't pronounce his full name. But he's an awesome guy. I did see him, and the thoughts of my oncologists were that it was radiation pneumonitis. But then I saw the pneumonologist, and he reviewed a CT scan just of the chest. And his initial thoughts were that firstly the radiation had failed, but they couldn't say for sure because it looked like the lung mets were still there, lung metastases were still there. But it didn't look like pneumonitis to him. And what it seemed like from my breathing test that I did there, full round of breathing tests, was that it was asthma that had come back. Now, I used to have very, very, very mild asthma when I was younger, in my teens and 20s, but it was nothing that ever really caused me any major issues. I had an inhaler, or puffer as they call them in Australia, but I wasn't on any maintenance medication, just rescue medication, which I used a handful of times, and then I seemed to, for want of a better phrase, grow out of it. But he said, yeah, the test was showing asthma. But then the thing that really blew me away was, after reviewing my CT scans, I've got early stage emphysema as well, which was quite evident. He showed me on the CT scans, and there it was, all these bulla, as they call them, which I don't know, you can see them, it's hard to explain, but they're very, very visible in the lung. And that's more than likely down to the fact that I used to smoke. So if you do smoke, don't smoke, it's not worth it. Good chance it caused my kidney cancer, it's caused emphysema. So yeah, it's pretty not good thing to do. But as my wife has said, I can't change it. And the good thing is I've not smoked for quite some years now, probably 6-7 years since I last smoked, long before even the cancer was diagnosed. And yeah, obviously no interest in smoking anymore. Cancer, early stage emphysema, asthma, that's back. But anyway, my pulmonologist started me on some medication that works dual for both the asthma and the emphysema. Worked a little bit, but not great. Then he changed the medication over, and it seems to have made some difference, but that could be due with some steroids that I'm on. But more of that in a minute. So I did end up having another CT scan a month later because, as I say, the breathing was getting a bit worse. The meds had the new medication had helped the asthma and emphysema, but yeah, I still wasn't feeling great. So we did the next CT scan, and it was great. Chest, abdo, pelvis. No evidence of disease, and it was like, whoa, that's fantastic. The lung tumours are wiped out. There's no recurrence in the kidney bed where the kidney was, or my other kidney, or elsewhere. Over the past 12 months, we've been worried about one spot on my liver that became 2 spots on my liver, that became 3 spots on my liver. Now, my oncologist is now pretty convinced that they're benign liver cysts. Nothing to worry about. And there was an issue with my pancreas as well, which they're now pretty comfortable with the fact that it just appears to be inflammation, again, benign inflammation with nothing to worry about. It's always in the back of my head, but I've been quite confident up until probably this past week, but I'll explain why in a minute. So, no evidence of disease, fantastic. However, radiation pneumonitis, oh my God, it was everywhere, over my lungs. I could see the CT scans, and I'm no doctor, but I've seen a lot of CT scans the past 3 years, and it was like, oh my God, what is that? It looked like someone had snowed all over my lungs. And there's just this scarring stroke inflammation all over the lungs. So they popped me onto high dose steroids for 3 months, 50 milligram of prednisone. Anyone who's familiar with prednisone and steroids, they'll know that 50 milligrams is quite a lot. And it makes you hungry. Oh my God, it makes you hungry. So I'm fat. Yeah, very fat. I've got it written down, my weights now, so I can give it to everybody in pounds, stone, pounds and kilos. So I always used to sit around 88 kilo, give or take 2 kilos or so, which was 13 stone 12 pound or 194 pound. Now I have ballooned, and I think I'm still going up to 103 kilos, which is, you can probably hear my wife giggling in the background. She finds it highly amusing. 16 stone 3 pounds or 227 pounds. So this is in 2 months. 15 kilogram, 2 stone 5 pound or 33 pound increase. So yeah, I've got chubby, now I've got fat, but it's the steroids, I can't do anything about it, and I'm enjoying my fish and chips and my pizzas and my cheese and whatnot, and yeah, I've got the excuse, it's the steroids. But like, jokes aside, I know I'm going to have to try and lose this weight in a few weeks when I come off it. But Haig Young's quite convinced that I'll just keep on eating because I've been really enjoying it. And I'm quite happy in my chubby body. I don't know, I kind of feel fat and happy. So, but yeah, that's where we're up to now. Saw the pneumologist again, probably 2.5 weeks ago. And the pneumonitis is still there, which isn't great. So I don't know whether I'll have to continue push the steroids up again in 2 weeks when I see him again, when I was meant to be completely off them, because I am tapering down. I've also got a chest abdo pelvis CT scan in 2 weeks time. Well, it's a week on Friday actually. So very nervous now. It's my oncologist has told me I've got no evidence of disease at the moment, but he was also quick to remind me that you're not cured, you'll never be cured, you'll always have stage 4 renal cancer, and it will be back. Given the biology of my cancer, the most highly aggressive you can have, he said it's going to be back. So I don't know, it could be back on this scan. Hope not. It could be a year, it could be 5 years, who knows, but yeah, he seems pretty confident it will be back, and so I'm prepared for it. But when I do get the news, I won't be prepared for it, because it'll be like, here we go again. And I guess these past couple of weeks, I've started worrying about these liver spots again, and the inflammation on the pancreas, even though they're pretty like confident. He sounds really confident that they're just benign liver cysts and benign inflammation, but I guess if there's increase in size or anything, it's going to set my mind going again, or there's anywhere else it could have popped up over the last 3 months, in the bed of the left liver where it used to be, on the right liver, anywhere really. And then I actually met with my neurologist last Monday, finally, after 2 years, thanks COVID. It's been 2 years since I've seen him, because I see him through the public system, and things are just mental in the public system trying to get appointments. But I saw him, and that was that. I see him to do with vestibular migraines, and I mentioned something to him, and there's only my wife knows about this at the moment, but I'll put it out there for the world now. I've been getting these weird tremors in my hands, particularly in my thumbs, and they move and they lock. Like, my thumb will lock like this, or my fingers move and they get stuck, and then they'll release like nothing happened. And the neurologist was a little bit concerned, and he said I'd like to do a brain MRI. given, your cancer and whatnot, because obviously anyone who's familiar with renal cancer knows that the 4 main metastatic sites are the lungs. Hey, I can tick that one off as done. The liver, the bones, and the brain. So the brain's up there as a very common metastatic site. So we need to check it out, that these tremors in my hands, that they're not every day, but they're quite regular. It's 2 or 3 times a week I get these tremors, and yeah, it's really weird. It freaks me out a little bit, but they could be benign tremors, and it could be overuse of the hands. We use a lot of electronics and whatnot nowadays. It could be that, but it's just started, and it's affecting my digits, which are obviously like my fingers and my thumbs, and it's obviously the same part of the brain that does it. So they just want to make sure there's no lesions and there's no tumour appeared on the brain, which would be like, oh yeah, tick number 2 off. Hopefully not, but we need to know. So he said we'll arrange that, but it works pretty slow, the public system. But then on Friday I got the letter that's booked in for 4 weeks, and I was like, oh god, that's good, but it's kind of bad, because for the public system that's really quick. But we'll see. But at the moment we're in a really good place. No evidence of cancer, at least for 2 more weeks. And then we'll see what happens in 2 weeks at the next scans. I was kind of excited when I got the no evidence of disease, because I thought, hey, no more treatment, even though I knew that there would be, because I've been told I'll be on treatment for life. But I don't know, you kind of get excited, there's no cancer, so maybe he'll change his mind and say, yeah, come off treatment. But he said, no, treatment, you remain on treatment. So I remain on treatment. Stay on pazopanib, Votrient, at the dose I'm on now, so still get the wonderful side effects. I'll stay on that until there is progression of disease, as they call it, or in layman's terms, when the cancer's back. And then obviously the pazopanib will have stopped working by that point, and then I'll move to 2nd line treatment, which will be immunotherapy. And I will also move to a different hospital as well, because I'm seen through Icon Cancer Clinic at the moment. My oncologist is kind enough to bulk bill me, even though it's private. But once I need to go on immunotherapy, it's delivered in the same way as chemo, through either a port or a cannula, more often than not a port, which you get inserted into your chest, like a permanent cannula into the chest. And it costs a fortune to get chair space at the cancer centre, so I will move to the Mater Hospital in Brisbane, which he tells me will be seamless, because he's got a lot of contacts there and get me over there straight away. But I'd also stay under his care as well, so I'd end up with an oncologist with him and an oncologist at the Mater, where I'd be doing the immunotherapy. So yeah, still on treatment, but the diarrhea has been great for the past, a few months. Not really been struggling with diarrhea at all, but I've actually thought today it could be the prednisone that I'm on that has calmed the diarrhea down, which I'm being treated with for the pneumonitis, because it's used a lot in people with things like IBS, I believe, irritable bowel syndrome, and Crohn's disease, to calm the guts down and stop people with diarrhea and whatnot. So I don't know. I initially thought maybe it's been, April, May, June, July, nearly 15 months that I've been on treatment, and my body's obviously getting more used to it, I was thinking. But now I'm thinking, it may be the prednisone, but the proof will be in the pudding, or the proof will be in the poo, when I come off the prednisone, hopefully in a few weeks, whether the diarrhea comes back or not. But as I say, in a good place, pretty good place at the moment. We'll see how things pan out in 2 weeks at the chest abdo pelvis CT scan, and in 4 weeks at the MRI of the brain. Can't wait for that one to be locked in the tube for, I'm told it's going to take up to an hour. But we'll see how that goes, and I'll do another update then. Thanks everyone, see ya.
One question.
Yeah.
Do you think radiation is worse? If you go back to the before radiation, will you take it?
Oh yeah, this is, sorry, I meant to talk about this, and yeah, this is something Haegong and I have spoken about so many times. Radiation seemed to be a really good idea at the time. You know, cancer, radiation, get rid of it. Radiation has wrecked my lungs. It's got rid of the tumours, but I'm now reliant on, you know, inhalers and whatnot, which we think are, well, I'm told it's for the asthma and also the early stage emphysema. But the one thing that I keep thinking is my breathing was never, ever, ever this bad up until before, well, about 6 weeks to 2 months after the radiation ended. And obviously I've had the, it looks like, you know, I've had asthma on and off for years and it's got worse now. And the emphysema's not suddenly just appeared. That's been there a while and we've just found out about it. So yeah, my breathing's awful. Excuse me. Yeah, that was quite a comical cough. Good timing with the cough. And yeah, a lot of coughing and whatnot. Last night I woke up in the night and I was gasping for breath, and I actually on the verge of waking my wife up because I was freaking out because I couldn't breathe, and the inhaler helped a little bit. But yeah, the radiation has ruined my lungs, and with the pneumonitis there's the scarring, but there's also 3 pockets of little bits of collapsed lung within my lung. Not like a full collapsed lung, obviously, because I wouldn't be sat here. I'd be in hospital if I had a full collapsed lung. But there's 3 little bits of collapsed lung. So my lungs they're wrecked. And what we're trying to do with the prednisone, with the pneumonitis, is to get rid of this. Get rid of this inflammation and early stage scarring. But if we can't, it could develop into, I've forgotten what they call it now. For the life of me, I can't think what they call it. But it's a pretty awful condition where you end up with permanent scarring on your lungs and it just ends up progressing. So it's like, would I do radiation again? Maybe not. On the lungs? Maybe not. But I don't know, it's really hard. You've got cancer there and you want that gone. But now I've got lungs that are absolute awful and will likely never be the same again. It doesn't help the fact that I smoked for donkey's years, I know that. But the radiation has wrecked them. And it was the highest dose radiation I could have, so it was really high dose. But I don't know, and Haegong and I were only talking this afternoon or this morning about my chest abdo-pelvis CT and the brain MRI. What if the cancer's back now and radiation's an option? It's like, my God, what will I do? You know, I don't think I'll have radiation on the lungs again, but what if it's on the liver and that's able to be radiated, or what if it's on the pancreas, or what if if it's in the brain? I think it's a no-brainer. Forgive the pun. I think it would have to be cyberknife. I'd have to have that cyberknife radiation because I couldn't risk leaving lesions on the brain. But Haegong said, like, can it damage your brain? And I don't know. I don't know how. I know that cyberknife is very, very. I don't know. It's like, it's so perfect with the margins and whatnot, but I don't know, there's a lot of discussions that would have to happen there. If it's on my liver, I know that I'd definitely opt for surgery rather than radiation again, and the same with the pancreas. I'd opt for surgery again before radiation, which I don't know, probably sounds crazy, getting my abdomen opened up yet again. You know, it's been opened up 3 times in the past for appendix, gallbladder and a kidney removal. But yeah, I think I'd go for a liver resection and what they call the Whipple procedure for the pancreas, which I believe is They say that the Whipple procedure is on a par with open heart surgery in terms of recovery and stress on the body. But I'd be really scared of doing radiation again because I just don't want to damage anything else anymore. But yeah, so, and Hae Young's nodding behind the camera. She gets it, you know. And she's been amazing again for the past 12 months. Been there for me all the time with my tears and my anxiety and my moodiness, especially when it comes up to scan time. But yeah, couldn't do it without her. Love her so much. So she needs to come here again and say hello to the camera. No, she doesn't want to come back to the camera and say hello because she's got her PJs on. But yeah, thanks for watching again, and update coming again in probably, I don't know, maybe 2 weeks if things are bad. But after I've got the results of the MRI. Yeah, until then, thanks for watching. See ya.